Okay, we will now have Littleton. Rochelle Littleton, the Family Road Healthy Start Program Director.
Thank you, Dina. Good morning, everybody. My name is Rochelle Littleton, and I'm the Program Director for the Healthy Start Program. And in honor of September bringing awareness to Infant Mortality Awareness Month, I wanted to tell you a little bit about what infant mortality is about. Infant mortality is the death of an infant before his or her first birthday. And the rate is calculated by the number of infant deaths per 1,000 live births in a geographical area. And according to the data provided by the Office of Public Health, Bureau of Family Health, and the Louisiana Vital Records and Statistics, in 2020, in Louisiana, 448 babies died before their first birthday. And in East Baton Rouge Parish alone, 56 babies died before their first birthday, which is represented by the onesies you see in front of us. This is enough babies to fill 3 kindergarten classrooms, and they were not provided that opportunity to be able to do that. And according to the Louisiana 2017 to 2019 Maternal and Child Health Profile for East Baton Rouge Parish, the infant mortality rate for non-Hispanic whites was 4.9, while the infant mortality rate for non-Hispanic blacks was 13.2. Some causes of infant mortality are birth defects, low birth weight babies, that's babies being born before 37 weeks gestation, lack of prenatal care, and SIDS and SUIDs, sudden infant death syndrome or sudden unexpected infant death. Some ways to reduce infant mortality is to monitor your health conditions and practice proper nutrition. And you can also do this by avoiding harmful substances like marijuana use, cigarettes, and alcohol. You can do this by spacing your babies 18 months apart and getting prenatal and preconception care early in your pregnancy and as scheduled by your physician. It's also important to create a safe sleep environment and breastfeed your baby. So this is where the Family Road Healthy Start Project comes into play. We have a program that is free, and we offer resources and services to all pregnant moms, dads, and their families in East Baton Rouge Parish. We service moms if it's their first baby or if it's their 5th baby. And we work with young moms from 11 years old all the way up to 45 years old. And it's a wonderful program. We offer classes ranging from breastfeeding to car seat safety with installations. We do nutrition, fatherhood, and many other classes for the participants. We also offer sonograms, and they also get incentives for participating in the program. Every baby deserves a fair chance, and so we need every baby to join Healthy Start program and give their baby a healthy start. Thank you very much.
Next, we will have Renee Antoine, State Director of Maternal and Infant Health and Government Affairs from the March of Dimes.
Good afternoon, everyone. March of Dimes is the leader in the fight for the health of all moms and babies. Our goals are to reduce prematurity, maternal mortality and morbidity, as well as infant mortality, and increase equitable access to health care for those who are highest needs in our city, our nation, and as well as our state. For 80 years, we have made an impact in health for all of our nation. Today, we have invested in several prematurity research centers, not only in our nation, but across the globe, with the brightest researchers and multi-sector disciplinaries to come together to find what's really causing prematurity and what types of biological factors lead to infant mortality and other health outcomes for maternal child health factors. These centers are critical for not only our research, for those on the community level as well. And we won't stop fighting until every mom and baby are given their healthiest start. We advocate for policies that support moms and ensure access to babies as well. We empower and encourage women through programs like our supportive pregnancy care program. It's a form of group prenatal care. We were so happy to partner with Women's Hospital in the past years to implement that program for mothers who are high risk or from underserved communities. We also have our neonatal intensive care unit program. We're also happy to partner with Women's Hospital in the city of Baton Rouge. And this program educates healthcare staff. It also improves the NICU experience for those mothers who have had babies who were born too small, too sick, or too soon to go home with them. We're also very excited to have proven outcomes through state committees that bring together all of our researchers, our state leaders, and our thought partners around community access to care from the community level, the individual level, and the state level with government affairs. Life or death outcomes are often based on access to quality health care, safe housing, and economic stability. There is a higher chance of maternal death and infant death based on your race, ethnicity, your income, and your zip code. The U.S. has the highest maternal death rate among other developed nations. While everyone else's death rates are staying the same or declining, our maternal death rates are actually increasing. The same goes for prematurity and infant mortality. Every 12 hours, a woman will die from pregnancy-related complications in the United States. In Louisiana, we've had several near misses for our mothers during labor and delivery and up to 1 year following their birth experience. 2 babies will die every hour in the United States. And as I mentioned before, out of the over 57,000 births in the state last year, almost 500 of those babies will not see their first birthday. Also, in East Baton Rouge Parish, as mentioned, out of the over 5,572 births that occurred, 56 deaths occurred. That's unimaginable. These families are hurting, and so is our city. Over 800 low birth weight babies. We know that prematurity is a leading cause of infant death, being born too small, too sick, or just too soon. It really requires the highest level of care. Some of our NICUs, our neonatal intensive care units throughout our city and our state, may not be fully equipped to provide the appropriate level of care for these mothers and infants. Maternal health strongly influences infant health. Helping women achieve optimal health throughout their lives is key to reducing infant mortality. To remain as healthy as possible, women need adequate health insurance coverage and consistent access to quality health care. Taken alone, maternal death and preterm birth rates in the state of Louisiana are already alarming. When you factor in race, the story is even more deadly. There's a health equity gap in Louisiana, and moms and babies are at risk. The COVID-19 pandemic has only shined a spotlight on how vulnerable pregnant persons can be to viruses and underlying health risk as well. We have already lost both new mothers and infants due to the pandemic, and data clearly shows the need for enhanced protections for these special populations. The fear of attending an in-person medical appointment, having to delay a much-needed medical operation, or just not wanting to have a medical assessment around others has really left birthing persons and newborns without timely, efficient, and adequate health care to sustain their life. We must identify needs and gaps in services and resources. We must advocate for all moms, babies, and families equally, and we must activate for systems change and social equity. It's actually better for us all because prematurity costs a lot of money for our healthcare system, our state, as well as our nation. We spend billions of dollars a year in prematurity. So it's actually a win-win for businesses, for corporations, for families to get back to work, to have things like paid family leave and workplace accommodations when someone is pregnant. It also benefits us to have insurance at least a year following a birthing experience. We know one of the major complications of childbirth as well is maternal mental perinatal mood disorders. Most women are not able to get screened or referred in a timely manner. This also can lead to infant death as well. Your first birthday in this state and in this city should not be an if, it should be a when. A mother and a child in a picture for an infant's first birthday should not be a dream. It should always be a reality for everyone. Thank you.